Hi, you're on Rescue TV. Today I am absolutely delighted to introduce you to Dr. Narukar, my very special guest from the US. Dr. Narukar is one of the world's authorities on anti-aging without the scalpel. What he doesn't know about anti-aging is not worth knowing. Tell us, what are the latest trends that you're seeing in the anti-aging movement? I know that you are a renowned magician with the needle. You don't use the scalpel. You're all about fillers, lasers, and a little bit of Botox, and that can go a long way to preventing the ravages of time.
Absolutely, and you hit the nail on the head. A little bit can go a long way. So the trend is less is more. And every day I'll see somebody saying, please don't make me look like an alien. I want to look youthful and revived without being done. And whether you're in the Silicon Valley or whether you're in Hollywood, the trend is less is more, using these as artistic tools to sculpt the face as opposed to overfilling or over freezing or even over lasering a person.
That's right, and one of the things that I think is really interesting is that maybe even 3 years ago there was a new normal, and the new normal, exactly as you were saying when we were talking earlier, was, you know, the faces we were seeing on the Real Housewives series and some of the very exaggerated faces. But because we were seeing so many faces like that, people were maybe thinking, okay, that's an ideal to head towards. Thank goodness that people have peeled back and said, just make me look better.
Absolutely, and there was a little saying 3 years ago that cheeks were the new lips. If you remember,
yes,
10 years ago, the lip look was the in thing, and then the cheeks. We've gone back. Again, for various reasons. Number one, we have many different tools. I like to call it our palette. And even 5 years ago, we had limited tools in our palette. Now we have so many different ones that we can actually sculpt the face as opposed to just fill the face. We can actually relax the face. Even in the last 5 years, the way we do Botox has changed.
In what way?
Less is more. So the number one reason that women come to my office for Botox is the brow. Shaping the brow, lifting the brow, softening the brow, and not just chasing the 11s. You know, if you remember, let's get rid of the 11s. That's just one component. So oftentimes what was happening is Botox was overdone. Too much Botox was put in to actually completely eradicate the wrinkles.
And you had that really plastic look.
The deer in the headlights look. So you still want to move. You still want, and especially if somebody's expressive, you don't want to take away their expression, but you can soften. So we've shifted away from freezing to relaxing and also doing it more pan-facially. So there's a balance. You have a balance between the upper face, the lower face, and the neck. So we know exactly where to put the Botox and the fillers to do that. So we do a little bit more now around the crow's feet to open up the crow's feet, because the lateral tail of the brow is also depressing the brow. In a younger patient, for example, we'll just do a Botox brow lift, which is putting a tiny bit in the procerus and a little bit in the tail of the brow, and that gives that subtle lift. And I tell it, it's all about the eyes. We recently published a study, and it was in the April issue of our peer-reviewed literature called Dermatologic Surgery, and 600 aesthetically aware women who were naive to procedures were interviewed, saying, what bothers you most about the face? Guess what it was?
The eyes.
Exactly.
Yeah.
And it was also the lifting of the brow that they were feeling. They were looking tired because of the crow's feet, the under eye shadows, and of course the positioning of the brow.
And in terms of Botox and filler, a lot of treatment, you know, there's a lot more options for under the eye area. And I know a lot of my readers are, you know, working mothers who are not getting enough sleep. What can you do for that under eye area? And how can, you know, what are the best combination of treatments? Okay,
so this is something I see, I would say, almost on an hourly basis. Okay, and don't forget about the men, because the under eye dark circles are also quite aging. So it's a balance. So I call it periorbital non-surgical rejuvenation. So what happens is there's multiple things going on. There's loss of volume in the malar fat pad, actually in the cheek, that gives you more of that hollowing. There's crepiness of the skin. The quality of the skin is less elastic. That contributes to that sort of crepey skin, as well as the crow's feet. And then there's laxity of the lids themselves. So they all interplay together. And then in women, in addition, there's some thinning of the eyelashes too. So that makes your eyes look tired. So there isn't anything we can do just in one step to address these issues. So what we do is we relax the crow's feet first with a little bit of Botox.
Yes.
Then we address the crepiness of the skin with some sort of laser resurfacing.
Ah, that's what I was going to ask you, because it was the crepiness that no one seemed to know what to do with.
And it's not just one tool can do it all. So in someone like yourself, a younger person that has it's just very subtle, we may want to do a very light laser like the Clear and Brilliant laser, okay?
Wow.
In somebody that's more advanced with crepey skins, there's something called the fractional repair fractional CO2 lasers that really
and it can go under the eye?
Absolutely.
Wow.
And we put in little shields that protect the cornea, and you can go right to the lash line.
Amazing.
And makes a huge difference. It's very, very safe. And then finally, when we've combined those two, then we can put and I mean a little bit of filler. We want to put the filler along what's called the bone here, and we use a filler called Voluma. And what that does, a lot of women would come in saying, I want this, but I don't want to go under the knife. What can I do? That's where Voluma comes in. It's not about volumizing, but contouring. So when you put, yes, and lifting. And you just do it to yourself. If you put a little bit along the periosteum, look what's happening to the tear trough. It's becoming less prominent. And in the US pivotal FDA approval trial for Voluma, we looked at both not only what happened to the cheeks, but we looked at what happened to the nasolabial folds and the tear trough. And without putting any filler in here or any filler in here, guess what? There was collateral improvement of the nasolabial fold. And do it again yourself. When you do this, guess what? And then you don't look like an alien, because if you keep pumping this and this,
it looked like handlebars.
Exactly.
You know, there was a whole series of women who looked like they had handlebars on their face.
Because you're not pumping material, you're contouring the face. Okay?
You were telling me something very, very interesting, because I want to take it to the lower side of the face. Let's talk about the marionette lines and also jowls and neck fat. That was fascinating.
Absolutely. So that's where we've had some amazing advances in the lower face. And that's where, you know, when women would come to me, and even men, saying, you know, I'm feeling jowly, this is just not bouncing back like it used to anymore, but I really don't want to have a facelift. And the first thing I would ask them is, if you are considering a facelift, definitely do a detailed consultation, figure out the risks and benefits. And someone who's really, really jowly, that's the only option, okay?
But if you just want to tighten up the area.
That's the majority. They just want a little bit.
Yeah.
So the first thing we had was Thermage, which really,
I love.
And I love it too. And it's come a long way, especially with the vibration handpiece, because, you know, just like the dentist does this. So that gives you that gradual improvement in the contouring the jawline, doing a lot of Thermage around the jawline, and then doing full face all the way from the forehead to the neck gives that global lift. The two other exciting things that we have, one is they're both approved. Number one is putting in some filler as well, because when you put fillers along the temple and the cheek, that also lifts the jowls, okay? And we have subtle loss of volume along the jowl. We can put some filler along the pre-jowl sulcus that lifts it. But the piece de resistance, the hot new thing on the block,
and you heard it here.
The FDA recently approved a product called Kybella.
Kybella.
Yes, and Kybella is the first in class injectable to treat submental fat, the so-called double chin.
So it melts the fat?
Yes, it's a product called...
an injection that melts the fat of your chin.
Exactly.
Of your face.
Of your face, right. And it's really, and it's funny, I was just in Sydney, I was looking around saying, okay, who's the Kybella candidate? And then almost everyone has a little bit. So the ideal candidate is the one that really has quite a bit of fat. Now remember, it's not loose skin, but fat first.
Yes.
But there is some collateral retraction from the inflammation that's induced by Kybella that'll also give that feathering, that contouring of the jawline. So I think, again, what's the combination? I think ideally some Thermage, if you have submental fat, some Kybella, and then these are these bands, these platysmal bands that also draw the neck down, so a little bit of Botox along the platysmal bands.
Wow.
It's called the Nefertiti lift because it lifts the jowl. So you're using energy, the radiofrequency in Thermage, to improve the laxity and the quality of the skin. You're using it now in the US and hopefully soon in Australia. The first of its kind. You don't have to necessarily do neck liposuction anymore.
Amazing.
This submental injection and then some Botox. So It's all about combinations, right? It's not just one thing, but how to put it all together.
Thank you so much. I could speak to you for hours, both personally and on behalf of our viewers. Thank you for being on Rescue TV.
I'm very honored to be here, and thank you for having me.
We look forward to having you back.
I will be there.
Thank you.